And at the center, I know that you guys offer coaching and tips. What kind of advice do you give to people to help us focus and concentrate, help with organization, tips to help as we start to see those skills diminish a little bit so that we can still remain functional?
Sure, good question. So, I hear all the time, they're just not listening to me. So maybe husband's in the room watching TV and wife is trying to tell husband something and she can't get his attention. And so first of all, focus, when you're having a conversation with someone else, really focusing, cut out all the extraneous variables, turn off the TV, have a quality conversation, one-on-one, make sure you have good eye contact. In terms of organizing, keeping things simple, trying to focus on one task at a time. A lot of times we try and multitask, and multitasking it isn't really all it's cut out to be. Staying focused on one task at a time, finishing that task before moving to the next task is important. And when we start to work with people that are having some impairment, I had a patient the other day who is putting on winter clothes in her closet, and I asked, well, what does her closet look like? Does it have winter and summer clothes? And so I encouraged the daughter to just take out all the winter clothes and just have season-specific clothes in her closet, just simplifying and making things more straightforward as we get older. Writing things down is important too. Keeping notes, maintaining a calendar is very helpful as well. So.
Maybe you can get us started as we transition into what is normal. And we talked a little bit about that. How do I know what's not normal? As I start to age, how do I know if my memory loss signals early Alzheimer's or dementia?
Yeah, and as Dr. Burns was saying, and I always use the analogy